just wanted to give you a little update on where I've been and why I haven't been doing any videos. Got on a little roll there for a while where I was doing a ton of videos, and then, I think that one day I put out like 4 or 5. I haven't done any for a while, so let me just give you an idea what's been going on with me, and a video that has been a long time coming. One of my channels that I sub to, Brad from BC Truck, had some wrist issues, and I believe he was also looking to get some cortisone shots in his back when he was having back issues. And I told him I'd come out with a video and explain to him why I would hesitate to go through with cortisone injections again, and why I probably never will again. And it has to do with something that's happened to me personally. I have had somewhat of a lot of trauma in my life. Back in '93, I was struck by a vehicle, and I was, after the reconstruction, they said about 5 to 7 miles an hour faster. If the guy had been going that speed, I probably wouldn't be here. I flew up on the hood of the car. Last thing I remember was hearing the brakes squeal, and he didn't see me, and flew up on the hood of the car, flew up on the road, and I woke up in the hospital. I ended up with like a bunch of issues. I couldn't walk for approximately 30 days. I had a deep nerve damage, and I lost all sensation in my legs. Long story short, through all of that, I ended up with 2 lower back surgeries. They told me I was going to have problems, possibly later on in life. So I do have some neck issues, and what happened with that is I started to go to a pain management doctor, and I was getting cortisone injections in my neck. And they didn't really work that well. I mean, I would get relief for maybe about a week or 2, and then it would come back. But there was always that hope that eventually maybe it would last a little bit longer than a week or 2, and maybe a month, and then maybe a few more months, but it just never got to that point. Well, anyway, through the while getting those cortisone injections, I had fallen at work on the ice, and when I fell on my wrist, and I broke the scaphoid bone in my wrist, which is basically the little round bone here by your thumb. What happened was I also tore the ligament or tendon in half. So anyway, what happened was I thought I just sprained it. I left it go, and left it go too long, and I had to go see a specialist because I couldn't move my wrist anymore. It was so painful, and I knew it was more than a sprain at that point. After doing x-rays and all their testing and everything, my options were, what had happened is that scaphoid bone had died. So my options were to have a partial wrist fusion, which would give me, limited movement, but some movement, and that would be my quickest way to get back to work. So I opted for the partial wrist fusion, and that was supposed to get me back to work, and I believe it was like 3 to 4 months. It failed. It didn't work. I ended up getting even worse pain. So I went down to Philadelphia, see a specialist down there, the same surgeons and doctors that work on the pro sports teams, the Eagles, the Phillies, Flyers, things like that. And so they're the ones that know what they're doing. And they said that my only option was to have the 3 screws removed from the partial fusion that was on this side and have a full fusion done, which is what I ended up having to do. As you can see, I have absolutely no movement in this wrist. It's completely fused. So that is pain-free now, which is a great thing. So I don't want to drag this on, but I'm just trying to get to the point of where I'm trying to help Brad out from BC Truck here. So I had the wrist fusion, and then I started getting, the cortisone injections again, and I started developing hip pain in my right hip. So, it was just basically when I would get up off the couch, it would hurt a little bit, and what I did is I would, just I'd have to stop for a minute, and it felt like something had to adjust itself in my joint, and then I was fine. I could walk. I had no problems. Well, that eventually turned into just an initial bout of pain when I got up to pain all the time. Getting up, walking, sitting down, to hardly being able to put any weight on my hip at all. So fast forward, I go to the doctor. They do an x-ray, and they tell me I have AVN, which is avascular necrosis. It's also called osteonecrosis. What that is it's your bones die, and you have bone death, and it affects usually the age range is 30 to 50. I'm gonna be 46, and this was, mind you, this hip thing was started in January of 2016. So what it is there's 12 to 15,000 cases a year in America, which is, when you look at the overall population of 324 million people, it's 0.004% of the population get this. So it's fairly rare disease, but the people who have it know they have it, and once they have it, they reach out to support groups and stuff. I did the same. I was all online trying to find out everything I could about this. I've never heard of this, and so what happens is the blood flow to your bones is compromised, and that could be from the known risk factors are alcoholism, lupus, people going through chemotherapy, decompression sickness. Divers get it for prolonged periods of time. If over and over and over again they're diving to deep depths and things like that, it can cause it. Sickle cell anemia. But one of the other big things is steroid use. Now, those are the only known causes. So, it's a handful of known causes, and some cases are just idiopathic. There's no known cause. Brings me back to the steroid use. When I was young, I was very, very allergic to poison ivy, which a lot of people are. I would walk outside, and just the wind blowing would put the oils or whatever in the air, and I would get it. And I'd wake up, my eyes would be closed, my fingers would be welded shut with blisters, and I have scars on my legs where the poison got so deep that my skin cracked and everything else. So anyway, my mother would take me to a doctor, and I'd get shots of prednisone, or I'd get oral medication, prednisone, to take. And so that could be something that just caught up with me. Also, the cortisone shots. They're starting to find out that is a risk factor for AVN. In fact, the National Institute of Health states now that physicians should inform their patients before cortisone injections that there is a risk of developing avascular necrosis. I was never told that. I've been getting shots for years. I was never told that. So anyway, what happens is your joints every day, they wear down, they break down just from your normal daily routine and your movements, and your body with the blood flow replaces the bone that break. This is how it was explained to me by the surgeons, is the the old bone is reabsorbed back in, and the blood supply creates like a new bone. It repairs it. And this happens daily, every day. Every day that you walk, your hip joint, it's wearing down, and then it repairs itself. In avascular necrosis, the blood flow is restricted and it doesn't repair itself. And basically what will happen is your joints will eventually just become so brittle that they collapse. So it mainly affects your hip, your shoulders, and your knee. I found out that I had avascular necrosis in my hip once I couldn't walk anymore, and they also suspect that that's what I had in my wrist, because it can affect one joint and it can affect multiple at the same time. They tried what they call as a core decompression on the hip, and they drill holes into the bone, and that is supposed to stimulate regrowth and blood flow and to repair the area. The first step was non-weight bearing for 4 to 6 weeks. So basically on crutches, a walker, towards the end, once we thought we could put a little bit of weight on it. The other step is core decompression with stem cells, and they take stem cells from your pelvic region, they drill the holes into your joint, and then they inject the stem cells. And that's somewhat experimental yet. They're still working with it, but it's showing a lot of promise. That didn't work, and I believe that also led to the quicker collapse of my hip bone, because they drilled the holes in and made it weaker. It didn't work, so the blood supply still wasn't getting there, and what ended up happening is my hip joint collapsed. So this was last year. I'm 45 years old, and I've got a fused wrist, and I've got a complete hip replacement on the right side. And now there's things that you also have to worry about too, is the avascular necrosis. Any infection you get in your body, it goes right to, and not just the hip joint because of AVM, but any artificial joints that you have replaced, infection can go right to that joint because the joint can't defend itself. There's no blood supply there to create the blood cells to fight off an infection. And it's a very, very bad situation if it gets to your hip. The infection, in a hip replacement, the only solution is another hip replacement. So how many times in your life are you going to go through that? You get an infection. So what they do is you have to take antibiotics. It's cephalexin or something. You have to take it for the rest of your life. When I go to the dentist, I go every 6 months. Just for my cleaning, I have to take 4 antibiotics before I go for my cleaning of my teeth, and just not to risk infection. So it's a life-changing thing, obviously. So I just wanted to basically touch on it. I'm sorry if I'm dragging it on and stuff, but I wanted to touch on what was going on. I do have it also in my left hip, but it's not near as severe as the right. In fact, every once in a while it'll bother me, but it's not anything I'm worried about at this point. There is a very good chance that I will eventually have to have my left hip replaced. They tell you, usually one side of your body, if you have a shoulder or a hip, it's going to be the other side eventually too, because you're babying that side, the injured side, so you're putting more stress on the other side. So my main concern though is that I believe I have it in my shoulders now, and there's no cure for this. It's just the core decompressions and things like that are just non-weight bearing. It's just to give your bone a rest and to slow down the disease, but there's no cure for it. So I I believe that I have it in my right shoulder, especially. There's times where I can't lift my arm above my head. It's very painful. It feels like someone's stabbing a knife into my shoulder. So, that's another thing. I've had Capital Blue Cross for 12 years with my employer. I have never paid or had to get any kind of pre-approval to have any x-rays done, any, MRIs, anything like that. So I went to the doctor and requested an MRI, and they said, sure, absolutely, we should get it checked. So I make an appointment for an MRI, and I get a call on Friday that insurance is requiring a pre-authorization. They denied the MRI, and what Capital Blue Cross, I believe this started January 1st of this year. Their new policy is now that this is what I would have to do, is I get an x-ray of my shoulder, and then I start physical therapy. And then if I'm unable to handle physical therapy, what they will do is then approve an MRI, and then we can go further. Well, I don't know what they're thinking. There was a very specific and detailed explanation given to the insurance company on the pre-authorization for the MRI that I have this disease, osteonecrosis, avascular necrosis, and it's a bone disease. There is no cure for it. Why Blue Cross would tell me to get a x-ray and then go for therapy? What's therapy going to do for dying bone? It's not going to help me. I'm going to end up going for an MRI, and that's what the lady told me at the doctor's office. She said, this is exactly what's going to happen, and she sees it time and time again. And it's very frustrating, they would sooner pay for me to get an x-ray and then pay for therapy appointments, which I don't even know how many. I didn't even get to that point, to find out that I need an MRI and I need to go see a specialist again. So it's just been frustrating lately, things going on with my health, and, there's some financial things going on too, but, we all have that. We all get through that. But basically, I'm sorry for dragging on again, guys. I just wanted to get this out there for Brad, and let him know that, I would caution anyone on these steroid injections to think twice and do a little research. Just Google, corticosteroid injections and prednisone and avascular necrosis or osteonecrosis, and just Google it and see. And let's put it this way: I am living proof. I am one of the 12,000 people a year that get this disease. And I will not have any more steroid injections ever for the rest of my life. That's how adamant I am about the situation I'm in. So, basically, I just want to put this out there. I want people to get an idea. I had no clue. I've had, like I said, I've had injuries and I've had injections throughout the year. I never knew any of this. And if I could help one person out, and by the way, it's not a series of it's mainly long-term use, but you can get it from one dosage. There are known cases of people who have gotten this disease from one known dosage. So please just, be careful and, do your research. If anybody has any questions or anything, comment down below. I'll be glad to help you. Don't want to say I've become an expert, but I've done enough research in the last 2 years to feel like I, pretty much can. Maybe I could replace a hip by now. I don't know. If I had the tools, I probably could. But, all right. Thank you. Sorry for taking so long. Brad, I hope this helps you out. Just be careful. And I'm going to try to get some more videos out again. I don't want to promise anything, because you know how things happen, and you're not able to do it, and then you feel bad. And I know also, Joe from St. Bernard Acres, I owe you a package. I said I was going to get it out in the mail, but some things came up, and obviously I wasn't able to get that done, but I'm gonna get that